Hi, everyone. Welcome to today's Facebook Live. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. We have a good topic today and a timely one: how to stay safe as students and teachers return to the classroom. I'm pleased to welcome two of our top Henry Ford experts for this discussion. First, Dr. Tisa Johnson-Hooper, the interim chair of Pediatrics and medical director of Henry Ford's Center for Autism and Developmental Disabilities, and Dr. Allison Weinmann, an infectious disease physician and director of the Antimicrobial Stewardship Program at Henry Ford Hospital. Doctors, welcome.
Thank you.
Thank you for having us.
A reminder to our viewers, please read the disclaimer at the top of this thread. We certainly encourage you to ask questions, and we'll get to as many as we can during our discussion today. Also, we'll be posting a recording of today's discussion on our Facebook page later on today, and you could also find it at henryford.com/coronavirus. With that, Dr. Johnson, I'd like to begin with you. After a year and a half of virtual learning, students and teachers are now heading back to in-person learning. However, COVID cases are rising, as are hospitalizations, right? The pace of vaccinations are picking up, but we still have at least 40% of the Michigan population unvaccinated. That doesn't bode well for young people under the age 12 who are not yet eligible for the vaccine. I think it's safe to say that many students are anxious to go back to school, back to the classroom. And parents certainly are understandably concerned for their safety. So, Dr. Johnson, what advice would you have for parents to help their children manage their stress and anxiety?
Oh, thank you for that question, because we're definitely seeing a lot of parental and young kid concerns about going back. You're right, they're anxious and excited to get back into the classroom. I think as a parent, one of the first things I would say is acknowledge your own concerns and fears. Kids pick up on that. And the first thing I would do is let your young person know that their concerns, fears, or anxieties are normal. If they have concerns, more likely their friends or peers, even adults, have the same concerns. So acknowledge it, let them know it's natural, it's normal. Then address the fear and concerns with facts. Depending on the age of your child, right? You want age-appropriate conversation, very short, clear facts I would pass on to a young person. So you may say that you're going back to school. We know COVID is still around. At worst, we have this Delta variant that's more contagious. But then you want to empower them, give them the power to do something to feel better. So I would then tell them to reduce your risk of contracting COVID and spreading it to loved ones, your family, friends. You can do something. You can wear a mask, wash your hands, avoid, congested areas, avoid touching your eyes, touching your mask. So give them the power to be and do something different. I would touch base with my young person, give them a lot of anticipatory guidance of what's going to happen. Tomorrow's your first day of school, and this is what's going to happen. And you're going to wear your mask. You'll go in. You may see your friends with a mask. Some may not be with a mask if there's no mandate. But let them know what they'll see, and maybe help them ahead of time prepare for a natural reaction. After that school day, again, I touch base with them. I talk about how they felt. So really the key is having conversation, age-appropriate conversation, giving anticipatory guidance, giving facts, and then empowering them to do something. And that's going to help with a little bit, bring down the anxiety just a little bit.
Dr. Johnson, are there certain health habits that families should try to sort of reestablish with their kids sooner rather than later?
So every year, it's really the same thing. And this year is no different. After the summer months, you got to get back into the ritual, the routine of school. This may be a little bit more difficult because many kids have been away from the classroom for a much longer period of time. So the advice, again, is the same. I always tell families you want to start with establishing a really good sleep routine. That may mean if you have the opportunity to, some weeks ahead of going to bed a little bit earlier each and every night, avoiding those, late night all-nighters that's what normal kids do during the summer. They try to hang out as late as they can. So getting back in that bedtime routine, if you haven't done it yet and school's starting, next week for you, it's still not too late. Besides that bedtime routine, and you may find that your kids will complain they can't fall asleep right away. Anticipation of school and they're off their sleep schedule. Again, you want to give them the anticipatory guidance. It may take you a little bit longer to fall asleep, but that's okay. I tell my kids the goal is not to fall asleep, but to rest your eyes. That's the goal. They'll fall asleep with that. Avoiding those late afternoon naps that kids will get into when they're going back to school. They're tired, so they come straight home and they go to sleep, but that just perpetuates that cycle. So avoiding the after school nap. I always encourage exercise, but it's really important. The more exercise you get, you do rest better at night. So sleep, exercise. I always recommend looking at what you're eating. Kids tend to snack more in the summer, but really trying to have a diet high in protein before you go to school is very helpful. Eliminating or reducing those high carb breakfast, sugary cereals, Pop-Tarts, the things the kids love, because they're just going to crash, and that's going to perpetuate that feeling of exhaustion and fatigue in the middle of the day, right? So it's that sleep, exercise, diet. And then the last one that whenever I'm talking to families in the clinic, the kids kind of roll their eyes and say, please no. But I'm going to tell the families to reduce or even eliminate the screen. So what we know is, and all kids are like, I don't want to hear it, but definitely we do know that excess screen, that's TV, video, phones, computers, excess screen definitely has a negative impact on attention, on learning. It can cause a lot of agitation and frustration and intolerance. It definitely can impact the quality of sleep that you get. So these are just kind of just the framework of things I try to get families to gradually move towards as we go back into the classroom, into a structured ritual kind of a school day.
Good stuff. Dr. Weinmann, masking, unfortunately, has become a very polarizing issue, right? Despite the fact that they're a proven tool for protecting people. Can you talk about their effectiveness, not just for adults, though, but for kids as well?
Yeah, sure. Thanks. That's great advice. Great question, Dave. I just want to reflect on what Dr. Johnson's saying, and all that advice is great for parents as well. Everything that she said applies to parents to decrease our stress when our kids go back to school. So I think those are really important pieces of advice. So masking, yep, not a political issue, simply a scientific issue. We know how COVID is spread. It's really easy. We know that masks work. So the most important thing before masking is immunization. And I want to get that out front. It is not, again, a political issue. It is science. So you want to protect your kids. The best way you can protect kids that are too young to be immunized is to make sure every single person around them is immunized or masked, and preferably immunized. And that's really the marketing tool you can use for your family and friends. Listen, I want to protect my 2-year-old. I want to protect my 4-year-old. Please, if you want to see us, you need to be immunized. And that's the most important messaging we can spread to get rid of all this and to, work towards ending this pandemic. So masking is not going away anytime soon. It's just a fact of life. And we are now kind of used to that. And most of our kids are used to that and just take it as read. So when you're looking for a mask, the really important is fit. Kids' spaces are smaller. So Dr. Johnson probably has better advice than I do about where to get kid masks. But you want something you can't see through. If you can see through it, it's too thin. You want something that's got a couple of layers if you're going to use a fabric mask. It's always good to have a little metal piece at the top so you can squeeze it and get better fit. You want to make sure it fits well around the face. If you have to fiddle around with the earpieces, so be it. Just make sure it's tightly fitting so that secretions from other people, their respiratory secretions, can't sneak in around the mask. That's the basic thing. And remember, it always has to cover the nose and mouth, both. So people can't let it slip down. If it slips down, I always tell people, do you mind popping your mask back up? So it's really important to wear it properly. Surgical masks are fine. Procedural masks are fine if you can get them. Otherwise, cloth masks are fine and effective as long as they're layered and they're well-fitting.
Do gaiters count as a viable option?
Yeah, I don't like the gaiter personally. CDC's gone back and forth on gaiters. I think they are very inclined to slip down. They don't have the metal piece. There's nothing around the ears to secure them, and I think they're hard to wear anyway. So I personally don't like a gaiter. I know they're cool and trendy for some teenagers, but again, you're looking to avoid secretions coming in. So it might be better to just wear a mask that's well-fitting. And I don't think I've ever seen a gaiter that's well-fitting and stays in place when you're talking, when you're laughing, when you're out with your friends. I think gaiters are really problematic.
How often should you change your mask, Dr. Weinmann?
Yeah, so, it's really very simple. So, for healthcare, we wear one mask all day long, as long as it's not wet or soiled. So for kids, it really depends on what your kid is doing and the age of the kid and whether they can self-monitor their mask. So if the mask gets wet from secretions or sweat, or they're outside running around and they happen to be wearing a mask, or they're inside and ventilation isn't very good, you should change the mask. So you should send your kid to school with 2-3 masks. Schools should hopefully have boxes of masks that if a kid gets, their mask wet, especially the fabric ones, then you need to change out your mask. And it's important if it's fabric that you do wash them at the end of the day. And be careful taking them off. You don't want to be touching the outside of the mask and then handling your face and nose, because there could be virus attracted to that. So you want to make sure hand hygiene, you've got hand sanitizer everywhere, and encourage people not to touch their faces. So it's astonishing how often we touch our faces normally. I think mask wearing has kind of hopefully put a bit of a damper in that, but you really don't want to touch your face. The mask is there, get it well fitted, and then leave it be.
And we should still adhere to all the hand hygiene things that we've been taught since our younger years, right, Dr. Weinmann?
Right. It's really true what you learned in kindergarten, right? So hand hygiene is important, but much more important than surfaces, washing your hands. It's very important, but what is most important is masking, because you don't want to come in contact with someone else's secretions. So the chance of you getting from surfaces, and I think really the emphasis needs to be on A, vaccine, and B, masking. And yes, it's hand hygiene before you touch your nose or your mouth, like before you eat or drink. Definitely, if you have been close to somebody, it's cool to do hand hygiene, but really much more important that is your mask being on at all times. Socially distancing, it has to be off when you're eating or drinking. Mask is everything.
Dr. Johnson, anything to add to the topic of masking, especially for kids? Are some masks better for kids than others?
So I think the guidelines that Dr. Weinmann laid out really should be the framework when selecting, a mask. I don't have a particular brand or a particular store or online area that I'm saying I only shop at this. It's really those guidelines are perfect. Appropriate fitting. I love to be able to, squeeze down the nose to keep that fitting. And I agree. I've seen some kids with the ear piece that just are floppy, and it's not really effective. Practicing with your kids on how to wear it. It's not going to be helpful if it's worn around their chin or just under their nose, but practicing, how to put that mask on, whether it's putting it on their stuffy, their lovey, so they see it, look at them in the mirror and say, this is how you want to wear it. Not like this, but just reinforcing that. So it's not a particular brand, but you're wearing it, appropriately.
Dr. Johnson, should kids have a say in whether they should wear a mask or not? And if they do resist, what can parents do?
Yeah. So the short answer is no. I don't think, I have never thought about whether you should ask, your child whether or not, they want to go to bed at their bedtime. They're going to say no. Do you want to eat your vegetables? They're going to say no. Masks are used to keep them healthy. And just being a kid, you tend not to want to do the thing that is oftentimes required. But as a parent, I think it's your job to set that expectation, give them the tools to be successful, recognizing kids are different, just like adults are all different temperament, different abilities, right? I will tell you in my work as, working with children with special healthcare needs, I have children with intellectual disabilities, children with an autism spectrum disorder, and they successfully wear their mask. It may be a little bit more of a challenge. It may require a lot more work on the parent caregiver's part, but it can be achieved in most instances. So it's really setting the expectation. I use the example, you have the expectation your children will wear their clothes when they go outside. This is just another expectation. For young children, you may have to practice. You can practice at home. Do it while doing something fun. I heard of a parent that in order to get his children to adhere to wearing their mask, he'd only let them watch their screen when they had their mask on. So as a result, they were wearing their mask all day in their own home because, so they immediately acclimated to it. It was no difficulty as they walked out into the community. They were able to wear their mask. So there's all sorts of approaches parents can take to encourage. It really is setting the expectation, model the behavior, what you want them to do, reinforce the behavior when they do what you want them to do. And for the younger kids, give them that anticipatory guidance. So you can say, the rule is we're going to wear our mask when we go out in public. What are public places? And kind of list those for the kids, right? You get to the public place, and I used to do when my kids were younger, before going in, I would say, are we going to scream and cry? And they'd say, no. Are we going to hold mommy's hand when we cross the street? Yes. You can say, are we going to wear our mask, through the store? They'll say, yeah. And then you say, okay, if we can follow these rules, these store rules, when we get out, we can have special time. We can ride bikes together. We can bake something special, so make it fun and engaging and not a punishment. And I think with those steps, quite honestly, I have not encountered a circumstance where a child ultimately was not able to wear a mask, even as young as 2.
Which prompts the next question. Remind our audience, what's the youngest age that a child could wear a mask?
Certainly. Well, the American Academy of Pediatrics definitely recommends mask wearing for all children of the age 2 or older, unless they're unable to safely take off that mask if need be. And by age 2, kids have that fine motor dexterity to be able to remove the mask if needed. Some even older children who may have a lot of secretions and keep the mask, in their mouths, chew on it, mouth on it, or cannot take it off independently if they have, for instance, like a cerebral palsy. Those are children that, it's not necessarily an age, but more of a safety issue. But by and large, children that are 2 and older can safely wear a mask.
Dr. Johnson, continuing on the mask theme here, at schools where mask is optional, what's your advice for parents to help their children deal with potential bullying issues from their classmates or even parents for that matter?
Right. I was going to say even parents, sadly. So I truly think of mask as I think of any other issue or expectation that a parent may have for their individual child. And if I have the expectation that I want my child to wear a mask because it is the safe and right thing to do, I can anticipate when it's not a requirement. There may be some children who don't wear a mask. And most kids like to fit in, right? Just naturally, they want to do what their peers are doing. And so as a parent, I'm going to anticipate maybe that feeling for my child. And just like with any other expectation I have for my kids, that while your classmates may use naughty words, we don't. Your classmates may walk outside without a winter coat. That's not what we do in our home. So the job as a parent really is to teach your children the expectations and the rules of your home based on, your background, your religion, your culture. That's what we do when we raise our children. And mask wearing should really be no different. So we're allowing our kids to know our expectations. Then it's okay to say, if your friends say something, maybe you can say this, or let them know this may happen, but that's okay because this is what we do. I think it's really helping kids to have a sense of identity and be proud of the expectations and the rules that reflect their family. And so we really do that with most everything, whether it's our faith, our culture. Mask expectation really should be no different.
Dr. Weinmann, for teachers who have students who are deaf or hard of hearing or rely on seeing somebody's full face, right? What's a good mask recommendation?
Yeah, again, I don't have a brand name, but there are masks that have a clear plastic piece in the middle where your mouth can be seen. And we've used them in the hospital for people who are deaf or lip read, and they're available.
Yeah, one last question relative to the mask issue. Flu season's coming up. Last year, flu cases were at one of the lowest levels in recent memory. What can all of us do to protect ourselves to reduce the spread of flu this coming flu season?
Yeah, that's a great question, Dave. So every year we worry about flu. Last year we didn't see any flu, virtually none in Michigan. And the reason for that was really simple. Masks. They prevent more than COVID. They prevent all respiratory illnesses where you breathe in other people's secretions or aerosols. So this year, because we know it's kind of a hybrid of people wearing masks and not, the most important thing you can do, again, is get vaccinated. And vaccine is available, safe, effective for kids 6 months up. So 6 months to, 100 and over. They should all be immunized. And most places have their flu vaccine supply already in and will begin immunizing in September. If I had a young child that was about to go to school, I would make sure they got their flu shot before. It takes about 2 weeks to reach full immunity, but it also depends on when you can get your flu vaccine. But it's not too early to get it in the season. As soon as it becomes available, it should last you the whole season. And that and masking and hand hygiene also. So the same rules for COVID, protect against flu, just a different vaccine. And just for people's information, it's really convenient that the CDC has changed its recommendations so that you can actually get your flu vaccine and your COVID vaccine at the same time in different arms. So you might have 2 arms that are sore instead of 1, but you've had 1 visit and you're protected against both.
Should people be concerned about getting those 2 vaccines at the same time, Dr. Weinmann?
Yes, so we haven't really had a season yet where we've had that, but that's clearly the recommendation that you can do it. And theoretically, it makes sense that they're not going to interfere with each other. Most people have no side effects from flu vaccine except a sore arm. It's usually less severe than what they had with COVID. Usually the arm is a little bit more sore, but we're going to be recommending that people can get them at the same time because you've got to weigh against it missed vaccine opportunities, right? So if somebody's at the pediatrician or an adult, a parent is at the doctor, I want to make sure I get them both vaccines. I've got a captive audience right there. And if they consent, there's no even theoretical reason why they shouldn't get both. If they have side effects afterwards, Tylenol is your friend.
We have a viewer question from Dana who writes in, we've heard masks are to protect others. If I'm wearing a mask in a place where other people are not, am I protecting myself? Dr. Weinmann and then Dr. Johnson.
Yeah, so masks are to protect other people, but they also protect you. So you are being protected because the whole idea of a mask is that other people's secretions coming at you are being blocked by the mask. Same thing about your secretions. If you don't have any symptoms, you could still be spreading COVID, and so you're preventing your secretions from mixing with them. So, I say no matter what other people are doing, you should be wearing a mask to protect yourself and your kids.
I wholeheartedly agree. I have nothing to add. It most definitely will protect yourself as well.
Dr. Johnson, besides a mask requirement, are there other safety protocols that schools should be doing?
Well, certainly. So vaccinate for those 12 and older, mask is important, but allowing, regular frequent hand hygiene, I think is definitely important. Keeping the children spaced out where at least 3 feet apart is most definitely beneficial on something schools can do. Contact tracing for when there is a positive case in the school, requiring quarantining for those children that are positive, and staff, as well. I think they're just simple measures to contain the spread of COVID in schools.
How about for parents? What can parents do to help protect their kids? The mask, we talked about the mask. For those who are eligible to receive the vaccine, are there any other things that you would recommend safety-wise?
Well, I certainly would recommend, and I know pre-COVID, many families did this. Please don't send your child to school if they are unwell. If they are, I know parents are busy, they got to get to work, and we all have been guilty of, a slight fever, give them a little Motrin and kick them out the door. They'll be fine. That pre-COVID, we all did it, quite honestly. I'm guilty as charged, quite honestly. But that is something that I would encourage all parents to be highly mindful of. If your kids have a febrile illness, a cough, runny nose, congestion, they're feeling unwell, don't have them bucket up and send them out the door. And I think that's important. Parents can do not only for their children's safety, but for everyone else. That's definitely important.
Dr. Weinmann, you wanted to add?
I would just say anybody who has any mild symptoms needs to be COVID tested, needs to stay home and be COVID tested, whether that be the parent or the kid. We know with this new Delta variant, especially amongst vaccinated people, the symptoms can be pretty mild or not there at all. So there is an argument to be made for regular testing, even of asymptomatic people in schools, depending on your school's protocol. But certainly if your kid gets something even mild, like a runny nose, please go get them COVID tested because, hopefully they'll have a mild illness if they're unvaccinated, but it's really important that it doesn't spread around the school. So really important to incorporate testing into the regimen.
Dr. Johnson, on the issue of vaccines, are we still looking at sort of, fall, early winter for the approval of a vaccine for children under 12?
So I would hope so. I'm not going to, pick a particular date, but I do know with all the various studies that are out, research that's being done, it's really being done diligently, thoroughly. It's not going to be approved before it is actually deemed safe and effective for those children under the age of 12. But looking at the pace, I would hope, by late fall, we would have at least emergency use authorization for vaccine for children under the age of 12.
Can you talk about the difference between the clinical trials that are ongoing now for kids, how that is different from the adult vaccine trials?
So where the difference lies is looking for the safe dose, the most effective dose for those children under the age of 11. You should know that children are not just little adults. Right. There are a lot of differences, and we cannot extrapolate, the safe and effective dose for an adolescent and an adult and just assume we're going to know what it is for a young child. Children grow and change rapidly through childhood. So the current investigations are ongoing to identify the safest and most effective dose at the various ages of childhood.
And your daughter was very assertive about receiving her COVID vaccine. Tell us about how that discussion went.
Certainly. Quite interestingly, I was a little bit shocked that she broached the subject with me because Madeline has never been a child that took her vaccine with ease. It was always drama prior to, drama during, and drama after. And even though her mother's a pediatrician, she was the one you had to hold. And so she had received her adolescent vaccines already with the drama as we've known her to have. But as soon as that vaccine was approved, she actually came home from school and told me about it and said, hey, when can I get my vaccine? And so I was really shocked. And so I turned to her and I said, well, why do you want it? And she just really wanted normalcy. She wanted to be able to see her grandmother without fear or concern that she could be giving her grandmother this infection. She wanted just to enjoy the life of being a kid. And while I knew COVID impacted her as it impacts children generally, I was really struck. That was a conversation that lasted quite a bit of time and just how significant COVID had been on her in her life. So as soon as she asked, I arranged for it. And she was really brave. I mean, there wasn't one shed tear. I will have to say, she did tell me as we walked in, she turned to me and she goes, Mom, I feel like I'm going to run. It got almost there, but she took it and she was absolutely elated and proud of herself that she did.
Great story. And with the new school year upon us, Dr. Johnson, we would be remiss, right, not to ask you about what other specific vaccines all children should be up to date on.
Oh, thank you for that question. Because let me tell you, for certainly with the onset of COVID, we have missed so many opportunities for our routine childhood vaccinations. And sadly, in many areas of the state, we are not at our like 2019 vaccination rates. That really does put children at risk for many preventable childhood diseases, ones that we don't really see much anymore because of our vaccination rates. So whether it be chicken pox, measles, mumps, rubella, pertussis, these are things that we routinely vaccinate. And so I do encourage all families, and we've been making great efforts to engage our families to remind them the importance all vaccines for children. And if families out there have yet to go in for their routine well visit or their routine vaccinations, I would encourage them, strongly encourage them to do so. Because while we are focusing on COVID, we should not keep our eye off the ball of the other childhood vaccines that will prevent significant illness.
Dr. Weinmann, this question comes from Justin, who is watching on Facebook. How is the COVID virus compared to HIV, herpes, or chickenpox, or even the shingles virus? Can those viruses remain dormant? I think I'm understanding his question the right way.
Yeah, that's a very good question. Hi, Justin. So some viruses are really notorious for staying in your body, like chickenpox stays in your body, and there's nothing we can do to get rid of it. Excuse me. And as you get older, you can reactivate with a disease called shingles, which is usually it could be a painful itchy rash, for which is also a vaccine. So some viruses remain latent, what we call their hideout in your body, and reactivate at a time when usually as you age or your immune system becomes weak for some reason. COVID doesn't seem to do that or behave the same way. So COVID, you get an infection, you get your either symptoms or you're asymptomatic, and it runs its course, and then you have antibodies. But it doesn't, we don't believe remains latent, and from everything, all the science that we understand, it doesn't remain latent to reactivate later. If you get COVID again, you likely have a different strain of COVID. So a different type of virus, but a very good question. All viruses live in people. That's how they survive. And that's why we were so keen to get everybody immunized, because the fewer people who are susceptible to COVID, then COVID eventually dies out.
Dr. Johnson, here's a question from Riva. What is your advice on outdoor recess time and play dates with other kids? Are you recommending mask outdoors for the little ones?
So I love outdoor recess time. That's my favorite part of the school day. So I think everyone should have outdoor recess time. But when children are outside running, jumping, and playing, they do not need to wear a mask. Here's a caveat. I don't know what every recess looks like, right? And I don't know how tight, congested these kids are on their playgrounds. That certainly needs to be taken into consideration. Also, what that COVID rate is like in your community. That needs to be taken into consideration. I'm assuming for that playground time, we're talking about those children that are below the age of 12. So these are our unvaccinated kids. So if you can get this cohort of kids out on the playground and they're spread out and not congregating around one another, then I would say they wouldn't need to wear their mask. Was there a second part I missed on that question?
Nope, that's good.
Okay.
Dr. Weinmann, for those who are eligible to receive the COVID vaccine and are still unvaccinated, what's your message for them?
Oh, for goodness sake, please go get vaccinated. People who were worried about it being, too early, millions of people have received these vaccines now, not just thousands, millions. These vaccines are amongst the safest and most effective in the history of vaccines. They're wonderful vaccines. In fact, the protection rate is higher than almost any other vaccine that we have. So what happens is, just as we discussed, the more people who are unimmunized, you're really not just putting yourself at risk. It's not just a personal decision. It's a decision you're making for me and mine as well, and for everybody in the community. So if you're unvaccinated, the virus has the opportunity to form new variants, which the vaccine may not protect me against, or my children, or my grandchildren. So it's really a community decision. We all live in the community. It's important to protect you, your family, and everybody you know and love, and the greater community. So I really think it's time for personal responsibility with vaccines. Again, it's not a political issue, it's a scientific issue. This is the way to protect yourself against COVID. This is the way to protect the community against COVID. And this is the only way to end the epidemic. So I would encourage people strongly to get immunized. If you have specific concerns about your own health conditions, please talk to your primary care doctor. Reach out to an infectious disease doctor. Reach out to somebody that you know with trusted science, because there are very few conditions. In fact, the weaker your immune system is, the more you should get immunized. And we can also have a conversation about booster doses at that point. But really, it's the single most important thing you can do, as well as masking. So it's so important everybody get immunized. And we've seen how effective these vaccines are. So you hear about breakthrough cases. There are millions of cases of COVID worldwide. We are still seeing, of course, there's going to be a breakthrough rate of vaccine, right? Because it's not 100% effective. And some people whose immune systems aren't very robust may have a lesser response. However, when you look at who is sick in the hospital, who is dying, and who you see very, very, very few vaccinated people sick in the hospital. I've just finished rounding in the hospital, and the only people that we saw in the hospital with severe COVID, the only people, and I'm including young people, we're seeing it's skewing younger, all unvaccinated, and also skewing pregnant. Or, so I want to, again, caution, if you are thinking of conceiving or you are pregnant, please run to get your vaccine, because the initial recommendations were sort of, you could think about it, talk about it with your pediatrician, your OBGYN, but now the recommendation is very clear. Pregnant women who get COVID are at particular risk of severe disease and of losing their babies. And we've all seen too many pregnant women either lose their fetuses or lose their own lives and the fetus's life. So I would implore people to go get vaccinated. It's not too late. It's late-ish, but it's not too late. It's never too late to get vaccinated. So, and also you're protecting your young children. One of the most vulnerable populations we have now are young children who can't be immunized. And some of them, as Dr. Johnson said, are too young to wear a mask. So the only way you can protect those children is form a herd. You've heard of herd immunity, where everybody around you is vaccinated. We're the herd of our young children. So have the herd be immunized. And that's the best way to protect the most vulnerable amongst us.
Dr. Weinmann, what's your advice then? Holidays are coming up here in the next few months, indoor gatherings, sports outside. Kind of talk about some of those areas and your recommendations for how we should behave.
Yeah, everything with COVID is a bit of a challenge, right? So I think everybody's perspective just needs to change. COVID is here, there's no question about it. And we are working very diligently to get people immunized. I want to remind people that our treatment for COVID, once you're severely ill, is not as good as prevention. So once you're in the hospital, the treatments just aren't that good for treatment, the treatment options. So, again, we're back to masking, social distancing. I would avoid any large indoor or outdoor event that's very crowded, like a concert or a sports arena. To get together with folks outside, great. Outside always better than inside. Masked always better than unmasked. So think really carefully about each activity you're doing. What is the risk? It's the safest thing is to stay home in your bubble, right? Mm-hmm. But we all are eager to get out there in the world, and there are ways you can do it safely by getting vaccinated. Know who you're with. It's no longer rude to say to people, are you immunized? I have yet to encounter somebody who's vaccinated who's reluctant to admit to being vaccinated. So, if I was having people over at my house or entertaining outside, I don't think it's rude at all to say, hey, are you immunized? I would like to know that information, because if you're unimmunized, quite frankly, I'll see you on FaceTime. I'll do something else, but I may not choose to see you in person because of the risk you're posing. So I think, again, it's the same rules we had at the very beginning, masking, social distancing, hand hygiene, and most importantly, getting vaccinated and asking people, opening that conversation. Like I said, I just think it's part of normal discourse. Hi, how are you? I assume you've got your vaccine. Is that correct? Or, hey, if you did get your vaccine, good. Let me call you and talk to you about why I got my vaccine and why I think I want to not be actually with you right now, but I want to have a conversation with you about getting vaccinated.
Dr. Johnson, this is a question from Nicole. As a parent of a preteen who is still maturing, how does the COVID vaccine compare to other vaccines from a growth and or development perspective?
Certainly. So I think what you're asking is, in any way, could this COVID vaccine impact negatively on your child's development, on their growth? And I will tell you, absolutely not. There's going to be no negative impact on your child's growth and development. I heard you say that your child is a preteen, and I'll kind of back that up a little bit because I have gotten a lot of concern, not just about the vaccine, but even masks on development. For those young children, I've had some families really question the benefit of wearing a mask when those young kids are just developing language communication or social emotional development, and concern that some of our recommendations, like masks, could negatively impact that. And so while I certainly, especially as a pediatrician with a focus on development, appreciate that concern and have actually taken some time to really look and review how might that impact. I think what I have learned and discovered based on the studies that are out there is that children, well, we all use a variety of ways to communicate, not just verbal communication, but we are using those nonverbals. I think that's what families are concerned. Does the mask impact that? It's our tone of voice, our gestures, our posture that all can be used in communication. And I think what we have seen is even the youngest children, where they are learning language, learning how to use language, even the youngest children who are surrounded by those that wear masks are continuing in their trajectory of language development. With respect to vaccines, that has been a question that families have asked me about. How might this impact fertility, growth, and development? And we have not seen that these vaccines in any way negatively impact that young person's growth and development. I will say what we do know is even those adolescents that contract COVID-19, one of the things we are still seeing in a small cohort is that after the infection, some young people, definitely even in adults, are still bothered by those long-term effects of COVID, called those long haulers. We do not know what that impact of that long haul symptoms of COVID will look like over time. So it's not just the infection that the COVID-19 is helping to mitigate those risks, but it's those long-term symptoms as well that many young people are having to deal with as well.
Dr. Johnson, as a pediatrician, what's been like sort of the most common concern or question you've been hearing from parents, as well as their children, about going back to school?
Quite honestly, I think both kids and their parents are really concerned about the infection, COVID-19 infection, and contracting it in school. I've had a lot of families who were very eager to get their kids vaccinated and are eager to get those children where we do not have a vaccine for them, getting them vaccinated. They are very concerned about their kids contracting COVID. I think families generally want to get back to some sense of normalcy, so they're eager to get their kids back at school. But in getting them back there, there's that angst, right, around, am I making the best decision to send them back? And might they get infected if they go back to school? So we spend a lot of time really reinforcing the measures that child can do, that the parent can do to reduce those risks significantly. I still encourage parents to be as vocal as possible with their school system. If the schools do not have a mask mandate, very respectfully communicate your position to the principal, the superintendent. Go to school board meetings. And I'm not in any way advocating going to cause ruckus, but to go to voice your concern and bring with you, resources that can help back up your position that are based in science and fact. So encouraging folks to rely on science and the facts, and not social media as their source of truth and information, because quite honestly, it's going to be a lot of mistruths. So really, I encourage families to be engaged in their community, to advocate for their children and the children in the community.
Dr. Weinmann, what's your advice for riding on school buses?
So I was just listening to NPR on the way to work this morning. They were talking about a shortage of school bus drivers. So I don't know how many school districts that's going to affect, but what they were talking about is, you want to make sure that kids are masked, because it's like any other mass transit, right? If you're on a bus, you're going to be wearing a mask. Most school buses are going to be ventilated, so it might be getting pretty chilly on a school bus, but you want some cross ventilation because it is a closed space. You know how hot and stuffy those buses can get. So some people may choose to, drive their kids or carpool instead in a smaller group to get to school together. So those are all things that you should think about. Not saying you shouldn't use the school bus. There are lots of people it's not feasible to take your kid to school, or there may be other logistic issues. But just, again, like every activity, think think it through, talk it through with your kid. You could be on the bus. I need you to wear your mask. Just like, in the car, we asked you to put your seatbelt on. You have to put your mask on. And you want to ride the school bus, have the privilege of hanging out with your friends, you got to wear a mask. And if the windows aren't open, pop the windows open so you get some cross breeze, and wear your coat because it's going to be a little nippy come the winter.
Dr. Weinmann, this question comes from Anjana on who's watching here, and she asks, is somebody at a higher risk of contracting COVID from a child under 12 or from an unvaccinated adult, or is the risk the same?
And just rereading the question, just trying to make sure I understand it.
So are you more at risk of contracting COVID from a symptomatic or asymptomatic person, or from an unvaccinated adult, or is the risk the same?
Yeah, so I hope I get this right. So all unvaccinated people pose the highest risk to vaccinated folks, regardless of their immune status, right? Because immune folks are not going to respond as well to the vaccine. And by the way, if you are immunocompromised and you're an adult over the age of 12, now is the time to get your booster shot if it's been more than 4 weeks since your second dose. They're freely available everywhere. So basically, if someone has symptoms, then yes, you want to stay away from that person, and they should be quarantining. But your risk is the same. So even a vaccinated person who contracts COVID, they are protected in that they're unlikely to die, they're unlikely to be hospitalized, but we know they can harbor the same amount of virus in their nose, in their nasopharynx, as somebody who's unvaccinated. So all risk is the same. Right? So you really want to stay away from getting infected any which way you can. And again, vaccine and masking will protect you. So if you're immunocompromised, you want to make sure everybody around you is immunized, and you want to make sure that everybody's wearing a mask if they're outside of your little bubble. I hope that answered the question.
Yes, thank you. So we're going to wind out our discussion now, and I wanted to ask each of you for a final thought or take-home message. Dr. Weinmann, could you go first, please?
Sure. So I think it's a really exciting time. Everybody's nervous when their kids go back to school anyway. This year's different, unprecedented, as we keep saying. So, but it's really very simple, breaking it down to basics, just like Dr. Johnson said. The expectation is your kid should wear a mask. The expectation, and we should model that we all got immunized. We should tell our kids what we're doing to be proactive to keep them safe, not just at school, but in our homes and our communities. And we're advocating for vaccination. And we're using science. So I would say, if you have questions, make sure you go to trusted sources like your pediatrician, like your adult doctor, like the cdc.gov, like henryford.com, and don't get all your news on social media, because there's a lot of hype on social media. People are very frightened, understandably, but if you break it down into its simplest elements, we know how this virus is spread. We know how to best protect ourselves. It's just a matter of doing it.
Dr. Johnson.
I love everything Dr. Weinmann said, and I would echo all of that. I think with going back to school, we need to acknowledge it is going to be a stressful time, not just for the kids, but for the adults. I would like to encourage everyone to give themselves a little bit of grace and understand when you go back, the temperature may be a little bit heightened, a lot more anxiety. So as parents, definitely, I always encourage families to try to perpetuate, preserve peace. And that means taking the time, and coming up with activities that you can do as a family to help yourselves relax in this very stressful period that we're living through. So more than anything else is recognize that even if your child is vaccinated or they're compliant with their mask, they are thinking about COVID every single day, and it can impact, their sense of well-being. So try to, as a family, come up with ways that you can address those anxieties and those stresses, very small ways on an everyday basis, so that children will know and learn how to handle life stressors and anxiety and get through this stronger and healthier on the other side.
Dr. Johnson, one last question from Laura. She asks, is there any link with wearing a mask and protecting your children from RSV?
Say it one more time. I missed what you
said. Will the mask protect your child from contracting RSV?
So respiratory syncytial virus. So Dr. Weinmann had, even addressed this issue. The question had to do with influenza. So RSV is a respiratory virus. And yes, if you are wearing a mask, right, you are not, you're protecting those around you. If you're wearing a mask, you're being protected from RSV, out in the droplets in the environment. So it would be beneficial wearing a mask for any respiratory virus.
Good stuff. Great discussion, Drs. Weinmann and Johnson. Thank you for being here and sharing your insight and expertise. And thanks everybody who has been watching and for your questions today. You can find more information about the COVID vaccine on henryford.com/vaccine. Please stay safe. Please wear your mask. And if you have not gotten your vaccine yet, please do so. And we will see you next time at our next Facebook Live. Have a good afternoon, everybody.
Thank you.
Bye, everybody.